Assalamu alaikum. I Dr. Muhammad Akram, Department of Eastern Medicine, Government College University, Faisalabad. I would like to discuss significance of anion gap. It is a clinical tool to differentiate between the causes of metabolic acidosis, normal AG or increased AG metabolic acidosis. It is done on patients with altered mental mental status, acute renal failure, and acute illness. Normal AG means that metabolic acidosis is most likely due to inorganic causes, for example, HCl influence, chloride replaces bicarbonate, and the anion gap remains normal. Increased AG means that metabolic acidosis is due to organic causes. Diabetic ketoacidosis, a decreased level of bicarbonate is replaced by acid anion, for example, lactate, which is not measured and it increases the AG. AG shows the severity of acidosis and response to treatment. Respiratory and renal compensations in reverse metabolic acidosis. Respiratory compensation acidosis decrease pH, stimulate fast and shallow breathing, small, small breathing, increase hyperventilations, increase carbon dioxide eliminations, decreased carbon dioxide acid in blood, decreased formation of bicarbonate, increased bicarbonate, increased HCO3 over H2CO3 ratio, blood pH increases back to normal. Renal compensation acidosis, decreased pH, and increase excretion of H plus ions as H2PO4 and NH4 in urine. Increase reabsorption of HCO3 from proximal renal tubules. Increase HCO3 over H2CO3 ratio. Blood pH increases back to normal. Causes of metabolic acidosis. Causes are divided into two groups depending on the AG, whether it is elevated or normal. Causes of increased AG metabolic acidosis, pneumonic mud piles, methanol poisoning, uremia, diabetic ketoacidosis, also starvations, results in accumulation of keto acids, or aldehyde, or fenformin uh, poisoning, iron tablet, or INH poisoning, lactic acidosis, sepsis, shock, ischemia, CO poisoning, ethanol, alcohol, or ethylene glycol poisoning, salicylate. In addition to in adults, is causes both increased anion metabolic acidosis, and respiratory alkalosis. In children, it only causes increased anion metabolic acidosis. Causes of normal AG metabolic acidosis, severe diarrhea, hyperchloremic metabolic acidosis. It is due to excessive loss of HCO3 from the body, which is replaced by Cl. Drainage of pancreatic or biliary secretions, loss of bicarbonate rich fluid, renal tubular acidosis, inability to secrete H plus ions from distal tubules, and our inability to reabsorb HCO3 from the proximal tubules, adrenal insufficiency, aldosterone stimulations stimulates secretion of H plus ions in the renal tubules in exchange of sodium. In the absence of aldosterone, there will be retentions of H plus ions in blood, resulting in acidosis, carbonic anhydrase inhibitors, uretero enterostomy, surgical implantations of ureter into the intestine, or obstructive ileal conduct. Small bowel fistula, recovery from ketoacidosis, addition of HCl or NH4Cl. Treatment. Treat the causes for possible HCO3 administration if acidosis is severe. Respiratory acidosis. It is an emergency primary defect, increase in PCO2 in blood, decreased pH. It is due to decreased respiratory rate, retention of carbon dioxide, increased in PCO2, eventually increase H2CO3 in blood. increase in PCO2, increase in H plus and HCO3 by mass action, respiratory and renal compensations in reverse respiratory acidosis. Respiratory compensations, lungs cannot compensate respiratory acidosis. Renal compensation, high level of carbon dioxide PCO2 aids the process of renal compensations by supplying more H plus ions to the renal cells for secretions. Acidosis, increased PCO2, decreased pH, and increased excretion of H plus ions as H2PO4 and NH4 in urine. Increased reabsorptions of HCO3 from proximal renal tubules, increased pH back to normal. Thank you very much. डॉक्टर हाजिर आप शुरू करें